So part of our nutrition assessment is going to be obtaining dietary information. We're also going to be looking at pertinent medical and family history. But we also, in our assessment piece, we're going to be looking at physical findings. So this might include a nutrition-focused physical exam, which I do have a really awkward video of me doing a nutrition-focused physical exam on my YouTube page if you want to check it out if you're interested, or you just want like some comedy, then you can do that. But also we're going to be looking at ideal body weight. So know the Hamwi, I can't say a lot of these words, sorry, formula that's going to estimate your ideal body weight. I would suggest trying it out with, maybe even just yourself. Try men, women, you have small frame, large frame is going to affect it, quadriplegic, paraplegic will affect the ideal body weight, right? And even amputations too. So all of those things are going to affect the ideal body weight, and just practice, practice, practice. I used it every single day on my clinical rotations, and I did see quadriplegics and paraplegics and lots of amputations too. So all of that is important to know, especially when we're doing physical findings in part of our assessment. We want to know what their ideal body weight is. You might also look at percentage of weight change. So 10% loss within 6 months is going to be significant. It's going to help us assess nutritional risk. A lot of times we're looking at malnutrition when we see a lot of unintentional weight loss. So know how to calculate percent weight change. I feel like that's just a little bit of math, but give yourself just a practice. Maybe pretend you lost 20 pounds and figure out what the percent weight change of that might be for you. Now, when we start talking about body composition, there's a lot of different ways that we can measure that. We've got the bod pod, where you're going to sit in a little pod, and it's going to, I think it uses air pressure on you, amount of air displaced, I guess I should say. Like the hydrostatic weighing, where you go underneath the water. This is air instead of water. Pretty cool if you've never done that and you have the opportunity to. It actually sends you like a metabolic rate reading printout as well. And then we have bioelectric impedance. So that's that little thing that you hold, or those little silver things you see on the scale that you'll stand on, sends a little current through your body, gives you an estimate of fat. I tell people with that, it's probably going to be reliable if you have the same parameters set, in the morning, after you've gone to the bathroom, before you've eaten breakfast or showered, and you do that consistently every 6 weeks. It's going to be reliable, not super accurate because a lot of things can affect it, like hydration status. But it's a tool. It's a lot cheaper. But you do have triceps skinfold thickness. That's going to be measuring body fat reserves or measuring calorie reserves. And then we have arm muscle area, and that one's going to be more specifically looking at children and protein, energy, malnutrition. So it's important for growing children and helps identify possible malnutrition. That's the important one there. BMI, know how to calculate BMI, know the normal ranges of BMI. I know we talked about with pregnancy, if you have an underweight pregnant woman or an overweight, obese pregnant woman, how much weight did they gain? It's different. It's based on BMI. And know that at age 2 is when we start using BMI for age. So before we were doing like height and length for age and weight, but now at age 2 to 20, we're actually going to have BMI charts used as well. Then we have waist circumference and waist to hip ratio. Waist circumference, so we're just taking one single measurement around the waist, and that's going to be telling us risk factors for disease, and that's with a BMI of 25 to 34.9. And the important thing to know about that one, my notes, is that's going to be the best for measuring risk. That's because we're measuring the amount of basically fat around, it's close to your heart, I should say, so in our torso area. We do have waist to hip ratio, which is going to be measuring abdominal fat deposit distribution. So we're looking at our waist to our hips or our butt. And that's going to help us identify increased risk for obesity-related diseases like diabetes and hypertension. Males if it's more than 1, females if it's more than 0.8, and that's that ratio. So hopefully that's helpful. Some of the different things that you're looking at in physical findings, so body composition, ideal body weight, nutrition physical findings, hair, teeth, gums, skin, nails, those kind of things that you should be looking at, or doing a nutrition-focused physical exam when appropriate. Hopefully that is helpful, and that is all I have for that section.